So basically, we believe the happiness of the animals are based on two elements. One is the healthcare, the other side is lifestyle. So it's a combination. But if you talk about the healthcare side, we see many urgent basis issues in India. So that's why we step into this industry. This industry means veterinary industry. So if you talk about the urgency in India, if you compare the number of vets in India with Japan, one doctor has to take care of around 7,000 in India. But in Japan, it's around 1,100. So there is a huge demand and supply gap. So to fill this gap, we cannot immediately increase the number of universities which produce doctors. So we need to find a different option to fill these huge gaps. Because if you talk about the number of pets in India, it's around 23 million. And the average growth rate is almost around 11% per year. But the number of doctors cannot meet that number. So that's why we felt that we need to change some system in India. We can say it's in an emerging stage in India. So if you think about the history of the small animal practices in India, I think it doesn't have a long history, actually. If you talk about a large animal, yes, it has some they have some strengths. But if you talk about the small animal practices, I mean, still a lot of improvement has to be done in this country. Apparently, people stop going outside. That directly affects the sales of hospitals and the clinic. Some reports say so many hospitals have seen a drop in their sales. It's around 10% or 20%. But this is an essential service anyways. So if your pet falls sick, you need to go hospital. And the good side is, so many clinics and hospitals, especially in developed country, started new initiatives. So which means they started using technology. So they started providing the telemedicine, and they started providing the 24-hour chatting services. So the way the relationship between the veterinary doctor and the owners has been changed after COVID-19. So we are heavily focusing on the education. Actually, if you want to create a good, well-equipped hospital, if you have money, you can do it immediately. But education takes time. And we have veterinary advisory board outside of India. And the one famous doctor, Dr. Terry Fossum in US, is our advisor. And we are developing the training program with her. And we are providing the training based on that program. So in that course, we are teaching doctors focusing on the diagnosis. So to summarize it, so we are trying to level up the standards of the veterinary care in India. We've developed our in-house software for internal use and for our client use. So for internal one is a doctor can make a history, so which usually called the EHR in the market, electronic health record, so that the doctors can share the information immediately. So if you go to the GK2 clinic, if you go to the Gurgaon, if you go to the Bombay, others, every data is consolidated and shared. So for the client side, so we are providing the one app feature, so which allows them to make a booking and they can check their past health history and the payment history, many things. So these are something new initiative in this industry. But curiously, I mean, if you talk about the other industry like food or for those kind of B2C services, many things are digitalized. But in this industry, why you need to carry your vaccine record with physical form? Why you need to take such a big folder anytime you face emergencies? For us, these are very, the common sense. by using the smartphone to track those everyday data, but no one has done it. So we started. Our hospital is customer-oriented hospital, client-oriented hospital. The most important things we believe are, one is transparency, the second is accountability, and the last part is great customer experiences. So to achieve these 3 points, first we are focusing on evidence-based medicine. That means we are not simply only relying on one doctor's experience, but also relying on some evidences. That's why you can explain the needs of the test, needs of the blood test, x-ray to your customers, clients, and you won't get any complaints about it. So in Japan, there are around 20 million pets, and around 20% of people have their own pets. So they usually visit the veterinary hospital 4 to 5 times in a year to do some preventive care, which means vaccination, or deworming, etc. And plus, when their pets fall sick, again, they visit the hospital. So they usually the average spend per owner is around 30,000 INR. So that's the Japanese market situation today. In future, definitely we would like to expand our business pan-India, but we haven't decided where to expand it. Maybe it's in Jaipur, Chandigarh, which is a near city for us, but at the same time we're considering the Bombay or the Bangalore is like metropolitan cities.